Hi, good evening. It's Nurse Maddie again. This is part 2 of the video I just posted a few minutes ago. In this one, I wanted to tell you how the diagnosis comes about. So if you are having these type of seizures, you'll know the ways that it's diagnosed and what causes it, and basically some more treatment options. So non-epileptic seizures, they look like epileptic seizures. So to test whether you have PNES or PNEA, you need a video EEG. Sometimes it does not show on a regular EEG, and sometimes it doesn't show on a video EEG as well, because it may not penetrate the deep parts of the brain. So sometimes you have to go to a special list, like an epileptologist, I can't even say it, an epileptologist or a neurologist, psychiatrist, psychologist, which will run many different tests to try just to make sure they're non-epileptic and that they are PNEA or PNES. So the EEG detects abnormal electrical discharges in the brain, and for people with PNES, these don't show up. So a lot of time, like I said, healthcare professionals think that the patient's faking it, and they treat them like total crap. I was one of them, and I've been a nurse for almost 10 years. I had never heard of the diagnosis. I had heard of the term pseudo seizures, in which basically the name tells you that it's a fake seizure. So that term is outdated. Do not use it on your patients. Use the correct terminology: PNES, PNEA, NEAD. It has so many different names, I think, because we need more research done. That's the bottom line. We need more research. We need more awareness. We need to train our healthcare professionals how to deal with this disorder, because it's, like I said, as common as 1 in 5 people diagnosed with epilepsy, one of them is going to be PNES or PNEA. So what causes it? Well, basically, it's thought to be an expression of accumulated psychological stress over time. So you've never processed stress maybe, and then all of a sudden your body is telling you, hey, you have not dealt with something that's very traumatic and stressful, so you end up getting these seizures. Some people also said it was after head trauma or head injuries that they started having their seizures. I think it started with the concussion, but we'll never know because they can't pinpoint what so psychologists, psychiatrists, neurologists, social workers, you'll need a lot of these people on your care team. And you want to start treatment as soon as possible. I have seizures every day. They have not stopped. They have lessened, but they have not stopped. So, and the hardest thing is waiting to get into these professionals that deal with this disease, because there is not a lot of healthcare workers that know about it and know how to treat it. It's very important that I pass this along so more people are aware and more healthcare professionals will be aware and treat the patients how they should be treated. They are not faking. Trust me, having seizures is the worst thing. Your body hurts. Your entire body hurts. If you're having the tonic-clonic ones like I am having, and I can't do anything. I can't work anymore. I have to basically stay upstairs. My family won't let me go up and down the stairs. So it's life-changing. And the more we know about it, the more we can help. Medication does not treat it. So that's one of the more difficult aspects of having this disease versus epilepsy, because usually there's medications that can help with epilepsy most of the time. So therapy, like I said, cognitive behavioral therapy. Also, they do EMDR, which is desensitization and movement with your eyes. So there are some special people that will deal with that as part of the treatment. But research is ongoing to determine what is most effective. There's basically just recommendations right now. So there's also a great website to visit. It's called nonepilepticseizures.com, and I will post it below, and it has a lot of great information about this disorder and disease, so that hopefully we can educate ourselves and we can do better as healthcare professionals. We can do better. So like, comment, share. I really want to get the word out, because it's just so misunderstood, and it's sad how many people I have talked to who have been mistreated or told they were faking their seizures. You can ask my mother, as she watched me have over 90 seizures in about 8 days. So, thanks.